Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. How do you take your medications? Because some people say, I'll take the medications only when I'm in the hospital, or I'll take the medications only when I feel the symptoms. Remember, your emphasis was?
To use your medications every day, or like the prescription says.
Good.
Most medications are every day. Some of them are twice a day, some of them 3 times a day.
Okay.
So you ask your doctor, how should I use this medication? But remember, hypertension is not something that is cured. When you say something is cured, it means it's gone away forever. Something like maybe a cold, you use medication and it's cured, it's not coming back. But hypertension is not something that you use a medication and doesn't come back. It is there, it is chronic. Most of the time it's lifetime, unless you can change your lifestyle, and this helps. And we say this is lifestyle control. Even then you're still managing it, because you're changing your lifestyle to manage it. So use your medications every day. Use it about the same time every day. Don't use it in the morning today and use it at night tomorrow.
Okay.
Some of them work maybe 24 hours, some 18, some 8. So use it the way it has been prescribed.
Okay. Okay, so that's very important that you do that. Now, you can reach Dr. Tointel MD on 0707 660 7330, 0707 660 7330 on IG, Instagram at TellMDNG, TellMDNG. Now, we didn't talk about hypertension in pregnancy, but we do know that some women do have hypertension in pregnancy. Yes.
Some women do have hypertension in pregnancy. At times it's that they've been hypertensive, they've had high blood pressure throughout pregnancy. At times it's that they develop high blood pressure while in pregnancy. For just plain high blood pressure, we say, oh, their blood pressure is more than 140/90 after 20 weeks of pregnancy. And some have this situation or this illness that we call pre-eclampsia, where they have the high blood pressure, but their kidneys start to leak protein. So that's the difference. So the pre-eclampsia is not a great thing while in pregnancy. It can affect the woman and even cause death if you look at the complications that can come from it. So you need to talk to your doctor, follow up with your doctor, let them treat you, and they'll be able to tell you at what stage you need to use medications and what medications you need to use.
Now, thank you so much for saying that. Now, it's important when you're dealing with a pregnancy, particularly high blood pressure in pregnancy, it's very helpful that you register in the clinic once you become pregnant. And that's important because they will know, or it's better if they even know your blood pressure before you became pregnant, your pre-pregnancy blood pressure. Because sometimes the blood pressure changes in a way that it looks within normal range when you are pregnant. It looks within normal range, but the change between the top level, which is systolic, and the lower level diastolic is such that it has already put you in that pregnancy, hypertension in pregnancy zone. Let me explain that. If your blood pressure, for instance, your normal blood pressure when you are healthy is 100, let's say over 70, and then you become pregnant and your blood pressure now becomes, let's say, 120/85 or 120/90, it may look normal, but the fact that the up blood pressure has increased by about 20 is already putting you in that hypertension in pregnancy range, even though it appears normal. So that's why it's important for you to register early. When you get married and you're thinking of having a baby, go and get your blood pressure, know your blood pressure readings, and once you become pregnant, attend the clinic early, get your blood pressure, and monitor your blood pressure through the period so that you don't develop complications. Like she said, when you begin to have eclampsia in pregnancy, where you're passing protein in your urine and the blood pressure is spiking and other complications set in, the baby's life is at risk, your own life is at risk, and the whole family is in disarray when we lose a mother who is pregnant. Now, we didn't talk about risk factors in pregnancy. What are the things that predisposes some people? No, not pregnancy. That predispose some people into hypertension.
Okay, so there are lots of things.
Okay.
I like to group them into those you can change and those you cannot
change.
Anything.
Okay.
Yes. So, men, you cannot change being a man. That's a risk. We're not going into that, Dr. Joe. Okay. 2, the sex. I've already talked about the sex. The race.
Yes.
You cannot change
being a black person. Yeah.
Yes. Then age. You cannot stop aging. So those are risk factors you cannot change.
Yeah.
But there are some risk factors you can change. Weight, obesity.
That's right.
You can change that. Some habits like smoking, excessive alcohol intake, you can change those. We talked about sleep, lack of sleep, stressing. You can change those.
That's right.
But there are some other things I forgot that you can change. A familial inheritance.
Yes.
You can't unless God changes
you can't change the family.
You can change the family and the inheritance.
Yeah.
So modifiable and non-modifiable risk factors.
Yeah. You can also change some of the things like noise, exposing yourself to a lot of noise, because those things have been shown to cause high blood pressure too. Party noise, a lot of noise around, and smoke. Smoking in the environment. Studies have shown that people who are exposed to, these atmospheric pollutions, this smoke, a lot of smoke can also aggravate their blood pressure. Now, Dr. Toyin,
I missed out. Some health issues already happening can also lead to high blood pressure.
Yes.
Like some issues with hormones.
Yes.
Something like hyperthyroidism.
That's right.
When the thyroid hormone is hyperfunctioning. So those can also.
When you say hyperfunctioning, what do you mean by that?
That means excessive function.
Functioning. Okay.
Yes.
Okay.
So I like to say hyperthyroidism. That's the excessive function of the thyroid, and the thyroid is the hormone that really controls metabolism.
Yes.
So excessive metabolism.
Yes.
But it's a very easy diagnosis. There's more to it than, rather easy definition. There's more to it than that.
Okay. What about overeating?
Overeating leads to obesity.
It leads to obesity and it leads to
risk
factors. Yes, because time there was when people thought that the bigger your waist, exactly,
the richer you are.
Yeah. But hey, my friend, the richer you.
We are all working on our weight, on our diet, knowing that it's healthier. Even being overweight is a risk factor for some cancers and for high blood pressure.
Yes. Well, I hope we'll have enough time to talk about something like cancers, okay? I hope we'll have enough time. Now, what I want us to look at, let's look at another of these silent killers. Diabetes.
Diabetes.
Yes. We hear the word diabetes. What's diabetes?
So diabetes is a situation where there's a problem with metabolism or the breakdown or the use of sugars in the body. And we know that the main hormone, if you don't know, the main hormone that helps with the metabolism or the use of sugars in the body is called insulin.
That's right.
So at times there is a lack of the insulin, so the sugars are not being processed well. And at times is that the body is not just working well with the insulin, so there's insulin resistance. So that too could lead to diabetes. So in all, diabetes is an issue where there's a problem with blood sugars. There's high blood sugar.
Okay, that's so simple. So when there's a lot of sugar in your blood system, it means that when you eat, the food that you eat is broken down into sugar. And this sugar is supposed to be transported from your blood system into your body so that it's used as energy. But when the sugar is not transported, what happens is that this sugar begins to float around in your blood system, goes into your brain, and goes to different parts of your body. And that can create serious problems. Now, there are different types of diabetes. It can affect children, it can affect pregnant women, it can affect adults. Is there a difference?
Yes. So we have the type 1, which we would usually see at a younger age. Not that it doesn't affect older people, but we usually see it from a younger age. And usually it would occur in people that they have a familial inheritance. Although at times it does occur in other people, it might be because of some medications, that maybe they affected their pancreas, it might be because of some other health issues, and at times it occurs sporadically, but rarely so. Type 2.
Yes.
Type 2 would be the one that you will see as an older age, you would start in, or people that are obese. And we'll say obesity not as an insult. It's actually a diagnosis, a clinical diagnosis, where the BMI is greater than 29.9. So when the BMI is getting to 30, a BMI meaning body mass index, which is the ratio of the weight to the height, and we calculate this. So when that is over 30, or greater than 29.9, we say obesity. So obesity is one of the things that leads to diabetes in older age. At times, some medications, some people that have gone through health issues, they might be on some medications that might be causing diabetes. And at times, some hormonal health, some other hormonal issues, like we talked about the thyroid, so that too can lead to a lot of things can lead to diabetes. So the general thing we say type 1 diabetes, type 2, and there are some secondary types of diabetes. That's not type 1 and type 2.
Yeah, like gestational diabetes.
Gestational diabetes. So that's gestational meaning while in pregnancy. So people can have diabetes while in pregnancy as well.
Now, people say that when we think about diabetes, we've heard some people say that you got diabetes primarily because you drank too much sugar.
No. It has to be too much sugar over a sustained period of time, and then this has affected things in the body. So too much sugar will lead to obesity, which will lead to or a metabolic syndrome. Let me stop using the word obesity. Which metabolic syndrome, which comprises of truncal obesity, meaning people that have a big gut. Dyslipidemia, meaning the cholesterol in them is abnormal. Insulin resistance, meaning the tissues of the body are not using insulin the way they should be used. So, yes, I've lost my train of thought.
No, you're fine. You're fine. Now, you see, when you're talking about insulin resistance, sorry, that we have to go back a little bit. And this is the way sometimes I describe it to some people when they ask me. I say, what happens is that it's like you're getting letters from the post office, okay? The postman is supposed to bring the letters to your home. And then when the postman, in this case is the insulin, is supposed to transport the glucose into your system. Now, when the postman brings the letters to your home and your door is locked and your mailbox is not there, so they drop the letters in front of your house and the letters pile up. It's like, so when your body is resistant to insulin, so the insulin, the energy is not reaching your body. Sugar is not reaching your body. So the letters accumulate in front of your house. So that's the way I make it so that the layman can understand it. Yes,
and that house is the bloodstream. So there will be excessive sugar in the bloodstream, which we call hyperglycemia.
Hyperglycemia, yes. And when that happens, they begin to manifest themselves in very many ways. Now, it's one of the silent killers. But before we talk about some of the complications of diabetes, what are some of the risk factors that, I know you've mentioned some of them, but for some of our listeners and those who are watching online or watching on YouTube, so what are some of the risk factors that predisposes you to, particularly type 2, because that's the one that's a lot common and that's manageable and controllable?
We would see things like a sedentary lifestyle.
Yes.
We would see things like familial inheritance.
Okay, it runs through families.
Yes, it runs through families.
Okay.
I've mentioned obesity.
Yes.
I've mentioned some medications and some other health issues.
Yes.
Not necessarily age, unless, no, that's too complicated. So these are the most common causes or the most common predisposing factors that I can think of.
Okay.
Yes.
So when you don't have those things, it begins to dispose you to, and of course, she's mentioned sedentary lifestyle, particularly when you have a family history and then you are not doing anything. Now, let's begin to talk about some of the complications of diabetes, right? One of the silent killers. So that means that you can have diabetes, for instance, and you may not know until complications begin to set in, right?
Yes.
Good. So how do you get to find out?
Okay, so this will take us back to what is the diagnosis of diabetes.
Yes.
So how do you diagnose diabetes? Typically, you do it, now technology allows us to do it in our homes. So it's the blood sugar test. You can do a random, meaning at any point in time in the day. And when that result reads more than 200 milligrams per DL, that is diabetes. Or it can be faster, meaning you've not eaten anything, you've not drank anything that has sugar, that has anything that can be broken down to sugar, and the number is greater than 126 milligrams per DL, that is diabetes.
Over a period of time.
Yes, over a period of time. And if you use the A1C, the A1C is hemoglobin A1C or glycosylated hemoglobin. To make this simple, it's the coating of sugar on the red blood cells. So red blood cells die every 3 months. So when you get a well-aged red blood cell and you look at the coating of sugar on it, it can give you an estimate of what the blood sugar in that system has been for 3 months. And usually when that is greater than 6.4, when it's at 6.5, it's called diabetes. So some people will say, oh, my A1C is high because I just ate. No. Remember, I said it's over 3 months
period, 90 days.
So it doesn't lie.
Because I've seen some patients who want to cheat the doctor and they say that, oh, okay, I'm going for a blood check, so I'm going to control what I eat and how I eat within a short period of time, let's say that week. And then when they get there, but the A1C
was because it's an average of 3 months.
What the blood pressure pattern has been like in over a 90 days period. What the blood sugar level pattern has been like over a 90 days period. So that's very important. Okay, so now some of the symptoms that you have when you have high sugar. You may not know you have high sugar, just like you may not know you have high blood pressure. So what are some of the symptoms that somebody begins to have that should alert you that something is going wrong?
Okay. Again, we'll start from the head and we'll go to the toes. It helps make it
I like he makes it easy. And it makes it easy for you to understand too, isn't it? From the head to the toe, or from the toe to the head. Yes.
Okay. So at times it might start with lethargy, brain fogginess. It can get to the eyes. It can start with blurry vision. It gets to the mouth. You can start to have dry mouth because there's hypoglycemia. So the mouth gets dry, excessive thirst. And the skin, wounds that are not healing well, boils just because there's excessive sugar. Germs love sugar, so they will proliferate everywhere there's sugar. You can get to the hands, the peripheries like I talked about the other time. And you can see things like tingling numbness because the nerves are crying out. Maybe the blood vessel issues in the hands and the feet too, causing peripheral vascular disease, meaning issues with the blood vessels in the peripheries. You can get to the kidneys. It can go all the way from peeing out sugar and peeing excessively. So some people will say, if you want to know from old, when you pee, if ants surround
your urine,
there's some truth in that because after a while, when there's hypoglycemia, sugar starts to leak in the urine.
And the ants are attracted to the sweetness of the sugar.
Germs are. So excessive urination, it seems like all of a sudden you can't hold your urine. You're in the bathroom all the time. And you're saying, oh, it's because I'm drinking water all the time. But you're drinking water all the time because you're thirsty, because your mouth is dry, there's hypoglycemia. So things like that. So and then erectile dysfunction. Let's talk about that. Don't let's forget about that. At times it's that might be the presenting complaint that you can't make it come up and you can't hold it up and you can't keep it up for while you need it. So that's something else. So I talked about from the head to the toes. Wounds that won't heal.
And sometimes there's you mentioned blurry vision,
blurry
right?
Vision as well.
And loss of weight sometimes.
Yes, weight loss. So water weight constitutes most of our body weight. So excessive urination, losing a lot of water, then one starts to shrink in size. So most of the time when my patients present and they present uncontrolled diabetes, they would have lost a lot of weight. So that by the time you are controlling the diabetes and the blood sugar, the amount of sugar in their blood is going down, then they gain all that weight back. And they're like, oh, I didn't want to gain weight. Diabetes made me gain weight. But that's not it. It's because you lost a lot of water weight in the acute time. But once that sugar is controlled and reverses, then the water comes back.
So now, why should you get worried if over a period of time you take your reading. You have, let's say, your early morning reading, okay, your fasting blood sugar reading, and you notice that it's consistently high. When should you begin to get worried?
Okay, so I'll give you a visual like this. So when there's hyperglycemia, that means there's a lot of glucose in the blood.
Because I want you to make it easy for everybody to understand. Hyperglycemia means a lot of sugar in the blood. Just like hypertension means
excessive blood pressure or tension.
Yes. Yeah, okay.
So when there's excessive blood sugar in the blood, blood gets everywhere. And the way sugar does, sugar is a good thing and a bad thing.
Yeah.
Germs love sugar.
Yeah.
Even our body loves sugar.
Yeah.
We take excessive sugar, we start to gain weight. So the blood vessels too are affected by excessive sugar. They start to proliferate or grow in different ways and the ways that they shouldn't grow. And at times when they grow, they don't grow in good ways. So they are unhealthy blood vessels growing, if I will put it that way. So imagine that happening in the brain and they're at risk of popping, or even dyslipidemia, to meaning the abnormal cholesterol. And imagine all that blocking the vessels of the brain. That can lead to a stroke. And then in the eyes, because those blood vessels are not well formed too, or they are diseased, they can start to burst, they can start to leak, and then it can lead to blindness. We call that retinopathy. Retina is the part of the eye that helps to see, and pathy means there's a disorder with it. So if you go like that all through the body, wherever blood gets, wherever the blood vessels can be abnormal, there can be an issue with it. And wherever blood gets and there's a lot of sugar in it, that means there can be germs growing, so that people that have hyperglycemia or diabetes are at risk for infections. Name it: pneumonia, urinary tract infection, or non-healing wounds, dental issues. They will be the people that have a lot of severe and recurrent dental abscesses. They will have boils, skin issues, because germs love sugar. So that's my easy way of explaining it.
Okay, toe wounds.
Yes, yes,
toes,
ulcers on the toes.
Yeah.
And then they might not heal.
Yeah.
I had a patient once, this was when I first started practicing. He came to me and he had a wound on the bottom of his foot, and I was like, this is a weird place to have a wound at the bottom, at the sole of your foot. He said yes, that he had a nail in him and he was not aware, meaning the nerves in his feet were dead. He could not feel. And it's unfortunate because when that happens and the foot is placed on the floor, the body is not aware of the positioning of the foot. So you step on something the body does not know. Yes. You walk in a way and your toes are under this toe, the body does not know. So that leads to a lot of foot injuries. And we'll get to that about why you should see your foot doctor as a diabetic.
Yeah, that's very important. Yes. So now that you're talking about that, go ahead and mention it, because part of the treatment for diabetes is that apart from controlling what you eat, apart from controlling even your stress level too, apart from controlling how you behave, even your activity level, one of the other things is food care.
Yes, food care is very, very important. So like I just highlighted, if diabetes has been uncontrolled for a long time, one can lose sensation at the nerve endings. And you never know what those little sensations, what they do. It's just like walking and stepping on a Lego or stepping on a glass. You know, you flinch and you know there's something. But imagine if you didn't know.
That's right.
Then there's a wound there. You might notice because, there are blood stains on the floor, and then you see. But then because there's diabetes and it's not controlled, there's excessive blood sugar, meaning germs will love that wound, meaning that wound will not heal, meaning it will get infected. And the infection would spread because there's blood all over the body and there's excessive blood sugar all over the body. So you need to see your doctors, especially your foot doctor too, when you're diabetic. They need to check, are the nerve endings good? If the nerve endings are not good, they need to fashion up good shoes for you that'll help your feet stay and your toes stay the way they need to stay when you're walking. They need to check, are the blood vessels good? If the blood vessels are not good, then they will work in conjunction with vascular surgeons to try to open up blood vessels, and even at times getting a graft. A graft meaning like a blood vessel they can bring from other parts of your body or from a synthetic material to make sure blood reaches the places they need to reach.
Okay.
And at times I've said the blood and the nerves. So at times some people say they have neuropathic pain, and this is burning. It's your blood, it's your nerves crying.
Yeah.
Yes, because the nerves are diseased, because the blood vessels are diseased, everything is diseased. And you see some people have amputations.
Yes.
This is something that can happen to uncontrolled diabetics.